you. For those of you who are on the road, wherever you may be going to, traveling, working out, please just stay safe out there. My name is Adam Knight T. This is Home Affairs. And just by way of encouraging you this morning, I chanced on this that says that believe you can, and you are halfway through it already. That's the first step. Just believe you can do it. And that's when taking action comes in. So, whatever the situation is, if it's something you really want, you will first of all have to tell yourself that I am able to do it, imbibe it, and that will push you to taking action. How is your household? Mine is fine. Sometimes things are not as you would expect them to be, but once you believe in God and you trust God, you know it is well. I hope you're fine. The song we were playing says, Rise up. You may be going through tough times and all, but rise up. It is well. Home Affairs is brought to us by Corba Payments app, Corba, our life simplified. Onga, Mama's helping hand, and we welcome Kel Kids toothpaste for children between 2 and 6 years, a product from Samara Company Limited. Kel Kids, happy smile. Welcome on board Home Affairs. Dr. Paddy Ayate, we see you, Che.
Keep long, pa.
How many years? I'm so excited to have you here.
It's been a while.
Wow. So you know that for the past 3 weeks, if you are a follower of Home Affairs, 3 weeks we were talking about men's health. So we had Dr. Che in the studio, and all we did was Q&As, answering questions here and there. We still didn't finish answering the questions in 3 weeks, but we had to hold it. And then we said we were flipping the coin. So for the next couple of weeks, I don't know how many weeks Dr. Aite is going to give us, but for the next couple of weeks, depending on how long he has, we will be doing same for the women. So women's health matter, and we're spending time with the urologist. We have said that we're doing all of these because we want to have a lot of peace in our homes. If your husband has issues and he's not happy, obviously that's going to tell on the family. Flip it, the woman is not happy, they have health issues. They sometimes, what's even baffling is that people have health issues. They know that this is not exactly how it has to be, but they won't even, go to the hospital, speak to a doctor. And so these conversations particularly are not consultations that you think, oh, because I have listened, that's it. What we are actually trying to do is to let you know that what you are experiencing may need medical attention. So we give you insights, and then you proceed to see your doctor. So you are diagnosed and treated, so that ultimately we can have very happy and beautiful homes. Our phone number, because we're doing questions and answers, you can start sending your questions in already on 055 1111997. And then our phone lines will be on 0302216541. You can also interact with us on our social media handles at Joy997. And for those of you who would like to post to my inbox, it's Adam Knight T on Facebook. Doc, one more time, Akwaba. Yeah, feel
nah.
ye. Hey, you are looking good.
Everything. Adam Grace. Adam Grace. When you live by the grace of God, things tend to
Great.
work out fine.
Dr. Fadi Aite is a consultant, OBS and gynae. A colleague of mine said OBS and gynae. Obstetrician, gynecologist. Doc, where are you now?
I work at Elimas Health. It's
Okay.
a women's health practice in the airport residential area.
Elimax Health.
Elimas Health.
Great. So that's where you will find Dr. Aite. We'll talk about all of those by the time we are done with the conversation. Let me remind us also that our Drive Safe campaign is ongoing. It's brought to you by Joy News and the Multimedia Group, and we are supported by Toyota Ghana Company Limited, Toyota Superior Quality. We say avoid all distractions, keep your eyes on the road and hands on the steering wheel. Try to be visible at all times, drive with your lights on, and that's how you ensure your safe arrival. So drive safe wherever you find yourself. Great questions have started coming in. One more time, 0302216541. That's our phone line. We'll open it in like 30 minutes. And then if you want to send in your questions, please don't wait until it is 7:25 and then you send your question in. Please send it in right away. So my first question says that, can anything ever be done about extremely painful periods? Can any procedure be done? Every month I go to hell and back, and I don't believe that when I have kids it will stop. But that's something people say all the time, that when you have kids, then the painful and the PMS and then the painful menstruations will stop. Is that true?
Not necessarily.
Okay.
In some cases, it gets better after you have the first child.
Okay.
Similar problems with some people who have got irregular menses. Some people get better after the first child. But for a number of instances,
I want to understand what makes it. What's the correlation between you having kids and it's getting better in some cases?
For what you call primary dysmenorrhea, in other words, you'll be having. Okay, sorry.
I was going to say, Doc, please. I mean, well, we would like to know what it is.
Let's just.
So when you say it, please just break it down.
Let's describe it in easy to understand terms.
Exactly.
There are some people who just have the menses are painful, and when we examine, we can't find a cause for the menstrual pain. So it's usually due to a chemical imbalance or things of that sort. The hormonal changes that you undergo when you are pregnant, after you deliver that child, your hormones change. And for some people, that change causes them no longer to have the pains that they used to have when they were pregnant. For some other people too, we say is that after going through labor pains, you may realize that period pains may not be as bad as you thought it was, and then your pain tolerance adjusts, and you're able to accommodate it a little bit more. But that is not but for a significant number of people, there is a problem.
Okay.
And I'll give you examples of those problems. Some people who've got polyps, which are growths of the inner layer of the uterus, that are lying there and are pretty big. When you're having your menses, your body recognizes the fact that there's a mass there and it's trying to push it out. So you have severe cramping, extremely severe cramping. And it can get really bad. I've had clients that I've worked on who have told me that the pain was so bad they felt suicidal. And it comes with heavy bleeding, very heavy bleeding, flooding. Wow. You can't control the menses, you can't go out. And those people, there's a solution, because if you do a particular procedure that we do for them, without cutting, you can actually go through. It's keyhole surgery, minimally invasive surgery. Go in and remove the mass that is causing the problem.
I see.
And it can be done in an hour. When you finish, get up and go home. And the pain is gone.
I see.
Gone, never to come back again.
I see.
But that's only one cause of the pain, which can be easily solved in this country. There are other problems. There are people who, when they have their menses, their menstruation, not only do they menstruate out, but the glands that produce the menstrual flow are in the muscle of the uterus. So they menstruate into the wall of the uterus too as well. And that place is not designed to have
for
blood.
That.
So the pressure, the expansion, the chemical changes, the irritation, severe pain.
I see.
That's a totally different problem, and its solution, there's an operation that can be done for it. It's a difficult operation. But it can be done. And the
Coming
pain
from you.
Oh, it's difficult. The last case I did took 4 hours. But after you've done it, pain goes away. But as long as she's menstruating, new ones can grow. New glands can grow, and so a couple of years down the line, the pain may start coming back. There are others who not only are they having their menses coming out, but they have the menses in other places in their abdomen. So there's, once again, the glandular tissue that produces the menses produces menses near the appendix, near the ovary, between the bottom and the rectum and the vagina, in that small space over there. It likes that place, so you are menstruating there, producing blood which irritates the pelvic wall. I know somebody who has that problem in her chest. So when she's menstruating out, she's also menstruating in her chest.
What is that?
Some glands move from the vagina, the uterus, and end up in her chest.
And it's oozing out?
And it's not coming out, it's coming into her chest. So there's fluid around her lungs. They have to drain the fluid. I know somebody who had to have surgery just to remove the lung tissue, the wall of the lung, the what you call the pleura, the outer wall, which had endometriotic seedlings on it. It's called endometriosis, that condition. And so every month when she's menstruating and having pelvic pain and everything, she's also having pain in her chest, and then she can't breathe. I know somebody who had it in the head.
And does it usually go away after the period?
It subsides after the period. So
But the fluid is collected.
but the fluid is collected, and it's causing its own
Problems.
And next month a new fluid comes onto it, so it keeps expanding and it keeps
my
expanding.
world.
Endometriosis is a horrible condition. But once again, it can be investigated, and if it is found, there are treatments that we can give to control it. But if they tell you have endometriosis, we try and say, try and have children as quickly as possible, because the disease is progressive. It keeps getting worse.
I see.
And even if we do all kinds of surgeries for you, it improves the situation now, but it comes back.
I see.
So the trick is, sometimes the solution. I've had a client who was like, take out my uterus. I can't do this anymore. Just remove the uterus. Because her pain was coming directly from the uterus. We ended up having to remove her uterus. And now I don't hear from her every month. I hear from her like every 6 months. She say, Doctor, you did? So I did.
First question, and this is why it landed us. Me, I'm gutted already. Wow.
But it gets better. It gets better. And for people who've got submucous fibroids to heavy bleeding, those ones too can be removed. So if you have, the basic thing is this: if you have excessively heavy menstrual flow, if you have severe cramping or pain with your menses,
Okay.
it may not be one of those chemical things that we just give you medicines for. It may be because there is a disease process there that needs to be addressed.
Doc, let me find out. What about the pain that young teenagers, experience as well during their menses? Could it be any of these?
In teenagers, usually not.
Okay.
In teenagers, their major problem is that there's what you call the axis between the hypothalamus, the pituitary, and the ovary.
Doc, what is that?
It's like an instruction line. The top gives a command to the number one, gives a command to number two gives a command to number three. Number three
Okay.
executes.
Okay.
You understand?
The execution is the flow.
Is the flow. Now that line, the command structure in a teenager is not well developed. It's now learning how to do it. So they tend to have funny problems with their menses
I see.
and in that process. But as they mature, as that process, first month, second month, third month, 12 months,
It
24
gets
months,
better.
it gets better. The periods tend to get better in various forms. Some people, I know a family that all of them have got very, very extremely painful periods, and before the age of 30, most of them end up having to have, surgery and saying, no more before the age of 30. So there are families too that are like that.
I see.
There are people too who go through those kinds of circumstances. So it is a challenging situation. But for teenagers, it may get better. So with teenagers, you're not as aggressive about let's intervene. Most of the time, you investigate to find out if there's a problem, and if you can find a problem, you fix it. If you can't find a problem, it is one of those things that maybe you would get better and you can manage with medication.
Interesting. So I just hope that some of the questions that we will end up asking, all the questions won't sound this problematic. But in the case of teenagers, sometimes it's for you, a parent who has a teenager, and they go through this, the pain they go through. Sometimes in our case, your parents will just tell you that, oh, it's a woman's thing, every woman experiences it, so But then, and you won't ask questions because you're told it's a woman's
normal,
thing, and every woman. But the children you have today, why is it a woman's thing? Why does it have to be this? They will ask you all those questions when they are going through all that pain, and it's like you will have to be there to solve the problem. So what? You give a painkiller? It's okay.
Yes, we give
Paracetamol or something.
Well, sometimes things are a little bit stronger than that.
Than that,
so you
depending
give
on the pain.
So you give various kinds of analgesics or pain medicines to just to try and bring the pain down. We give medicines that will solve. Depends on the description of the nature of the pain, because
Okay.
there are different kinds of pain, and you treat according to the type of pain that the person is encountering.
So are you advising that, I mean, if you are a parent, you have a teenager, they've gone through the first stage of amenorrhea, they call it, and they begin to feel these pains, we shouldn't dismiss it. Do we necessarily have to take them to see a doctor?
I think if it's tolerable, you can delay.
Okay.
If it is affecting her quality of life,
Then-
it's something that you should have looked at.
Okay.
Just to even for the assurance, I call it the good kind of wasting money. You go and check and they tell you there's nothing wrong.
There's nothing wrong.
You understand? You're happy that there's nothing wrong.
Yeah.
Rather than saying that you delayed and when they discover, it's like, oh, we could have fixed this,
A long time ago. Great.
Because sometimes it is a problem.
Okay.
In an adult, most likely it's a problem. But for a teenager, it may not be a problem.
This is a very interesting question. I kind of feel I know the answer, but well, I'm not a doctor here. Is it okay to have sex while pregnant?
Yes. Simple
see,
answer.
I said I think I know
Yes.
the answer.
No problems at all. We say, have sex.
Under what circumstance should you not?
We will tell you
You-
when not to have sex. So
okay,
if we haven't
great.
given you X yet that we don't have sex,
Go
the
ahead.
recommendation usually is go ahead. We are concerned sometimes about the fact that a client that has bleeding problems in pregnancy, we are worried that the activity involved in sex may stimulate additional bleeding.
Okay.
So if you say the placenta is low, for instance, we don't want anybody touching the cervix, because even though she hasn't even bled, and we've done a scan, you've seen a low-lying placenta, and you hit that cervix,
That
she
could
can
be
bleed, and the bleeding can be torrential. You may not get to a hospital. So we are worried about those kinds of
Those
situations.
ones.
Before we would admit you and keep you in hospital because we are afraid of what will happen if you bleed. Now the patients are plenty and the beds are not that many. We can't afford that luxury anymore. But patients with those kind of conditions used to stay in hospital until they delivered.
No baby, no home.
Yeah, because we were afraid. You've got people who in the early pregnancy are bleeding because of a problem. The pregnancy is trying to spoil. We are doing our best to try and keep it. We would say we want the uterus to rest. We don't want anybody to touch it. Because the moment you touch it and it starts bleeding, we may lose a precious pregnancy. So we don't want you to have things of, activities of that sort. Sometimes, like in a very early stage of pregnancy, when a woman is vomiting excessively, where she can't stand the smell of her husband, after we've struggled to stop her vomiting and to control her, and she goes home, and then that kind of intimacy situation causes now the vomiting to come back all over again. After admitting and keep hospital, sometimes it's just advisable to say, you guys, something, take a little break until we can overcome this short hurdle. It's just about a month or two, and after that we can go back to activity.
I see.
So usually we would say that don't have sex, and we will try and do our best to communicate to the husband if he's accessible. That I beg, it is we that are saying that we beg for the next few weeks to have sex. A lot of people are worried, men are worried that, hey, they don't want to touch the baby, they don't want to harm the baby. No. If everything is normal, no, you can't harm the baby. You are not that powerful, please. Get over it.
They say you are not that powerful
No.
and you can't harm the baby until the doctors say that you can't. Please and
But please be gentle. Under all
exactly.
circumstances, be gentle.
I was just
Recognize
gonna
the fact
come
that
there.
acrobatics cannot happen in those stages. Recognize the fact that at some point in time we shall do only one position. You understand?
which is
Whatever is comfortable for the two of you.
okay.
No
prescriptions.
prescriptions.
Okay.
But we just let's manage it small. Soon she'll be back.
Okay. So you can have
And
sex.
some women have increased desire when they're pregnant.
pregnant. Okay.
And then you hear about the husbands running away. So those ones too are there.
Yeah, but I mean, for as long as the doctors have not said that you can't, enjoy it, but in moderation and gently, right? Okay, great. This one says, "Good morning, Adam. Please, my daughter." Oh, okay. The question just vanished. I have one here that says, I've never had an orgasm while having sex. I know I'm part of a lot of women who don't, but what can I do to begin to have orgasms? Ish.
There is
Is there a problem?
not Not
I want
okay.
to find out, apart from, all the nice feelings you get, the feel good thing, is there um is there something medical to not having orgasms? Because this comes up a lot.
Well, in medicine, we never say never.
Okay.
There's always somebody who has something that's, we are still discovering things. So yes, there are medical reasons sometimes why people cannot have
Orgasms.
an orgasm.
Okay.
But the truth of the matter is, most of the time, it is not a medical reason.
Ah.
Most of the time, look, we are created in a particular way. We are wired in a particular way. With men in particular, a particular kind of stimulation causes them to achieve an orgasm. There are men too who have difficulty in achieving an orgasm. We don't talk about it. It's not that out there, but yes, they also have that problem. But for women, it's significantly is a matter of technique, style, environment, approach, and she getting what she needs to have, an orgasm. My primary school, I have a very active primary school platform, and somebody posted a video about women talking about, orgasm. And these are 4 women on TV, and they were talking about the fact that when you hit the right spot, please stay there. Don't change, don't move, don't vary. Stay there, because once we hit that road, it is straight to destination.
Oh my God.
This is not the moment to start asking me stupid questions, to start changing. You're changing position. You're changing. No. Hit there. Just hit there. And one of my mates asked that women. They said, "Oh, it's not true. It's not true." And I said, "Oh, it is true." Then they said, "How do you know?" I said, "Ask your classmates." Then all the women on the platform, silent.
Oh my God. But of course, we don't want to talk about those things.
And we joked about it, but it is true that there is a way to do it and to get it right. And unfortunately, the only person who can show you is the woman. I mean, we can describe it, we can tell you the things you can try, and it's the woman. And because women don't upbringing, societal things, you don't do, and men's ego, because if you tell him this is what you like, then they start asking you stupid questions. I like the word stupid questions because they are stupid questions. How do you know this? It is a stupid question. Don't ask.
Dog.
Don't ask. Be grateful that you are benefiting from it.
The right path.
Don't ask. But it would be excellent if the chief examiner tells the student that this is what I like. Unfortunately, that communication is not there. The men are not often told what the women like. The men oftentimes don't try and find out what the woman likes. And they don't try and create the environment that makes it feel comfortable enough to achieve an orgasm. I know plenty of people who had never achieved orgasm till quite later on in life, after years of having sex. But then when they eventually got what they needed, yes, they did achieve an orgasm. And then after that, they have it, every time.
I see.
But it is knowing the right thing to do for that particular person. Every woman is different.
Okay. So it requires.
So, madam, it's possible.
It requires a lot of talk, a lot of exploration,
Mm-hmm.
and
A willing student
and
and a good teacher.
Okay, great. And so it has to be teamwork.
Certainly.
It has to be teamwork and then a lot of patience because I believe that you could be doing the teamwork and it might take a bit, not the first, not the second, but it might take a bit to be able to get there. And so for as long as you both are willing and you're not giving up, you'll surely get there someday. It's a nice place to be though. Good morning, Adam. Please, I want to know if it is normal to have a sharp pain in my right lower abdomen during ovulation and cramps in my lower abdomen subsequently, even though it is not yet time for my menses. This is from Mina. Did you get that?
Yes, it is quite. So what happens is, and it's usually not only on the right, unless she's got only one ovary, but usually we are created with 2 ovaries, one left, one right. And the 2 ovaries alternate. So this month, you release an egg, and next month, the other one releases an egg. Now, in the process of releasing the egg, releasing the egg, there's a follicle, which is like a small balloon, which will burst and drop the egg, and the tube will grab the egg. But as it drops the egg, it also drops a little bit of blood. Because take it note, it has burst.
Yeah.
And anywhere there's busting, like a boil burst on your body and there's bleeding from there. That bleeding falls down into your lower pelvis and irritates there. Blood and peritoneum, they don't agree. Once there's blood there, it irritates, it causes pain.
Okay.
So that bleeding that drops onto the peritoneum, irritates the peritoneum, causing the pain that you feel on her right side. That blood doesn't stay on the right. It then flows down towards the back and may flow towards the left. So it starts from the right and then goes eventually towards the left. So you now have pain and cramping pain in your lower abdomen running from the right to the left.
Because of the process.
Because of that process.
I
You
see.
may not, however, notice it on the left side as much. So most likely, even though she says she's on the right, it may not be every month. She may actually be having it every other month. If she's having it every month, we'll start asking questions as to the fact that, hey, what's happening with her ovulation? What's happening on the left side? It's an equal opportunity pain causer, left then right.
I see. So doc says it's normal. This one says that, good morning. Please, I had a myomectomy a year ago, and since then I haven't had my menses. What could be the cause? I was told I have endometriosis after the surgery.
The cause is this one. I
It's
know
a
what the
tough
problem.
one, eh?
No, I know what the problem is. Not something I like talking on radio. Okay, so there are one, let's say two main causes, but one of them is major.
Okay.
If you're not having your menses after the surgery, it usually means something is not right with the lining of the uterus. And the lining of the uterus has, let's just say, gotten sticky. It's stuck together.
Okay.
And because it's stuck together, it's not functioning the way it should. There's a procedure that you must do to examine it, and then you have to do a special kind of surgery where you can go through the vagina, through the cervix, into the uterus, look inside, find where the stickiness is, separate the stickiness, put some things inside to prevent it from being sticky. It's a whole process. And sometimes you may need 2, 3, 4 of those procedures just to get it back to normal. It can be quite challenging. Sometimes it's pretty straightforward. I've done some that you just go in and 5 minutes, I'm done. Patient is fine afterwards. I've done some too that you've done 3 or 4 and it's still tough.
Wow.
To fix. So depending on what it is, there are a few other reasons why that can happen, but usually she needs to have a proper assessment, both hormonally and surgically, to find out exactly what the problem is and fix it. The other challenge is that it must be done quickly, because every month it gets worse and it gets more progressive. That means the repair becomes more and more difficult. And whilst we are waiting, her endometriosis too is destroying things inside the pelvis. Ovaries, tubes are being destroyed. I would suggest that you seek care as quickly as possible.
Okay. Yeah, nothing more to add to that. This one says, good morning. I have some bloody, slimy discharge during my ovulation. Is this normal?
It happens. I wouldn't say it is normal. It's what we call a mid-cycle bleed. It usually means your hormones are not exactly well balanced and needs to be corrected. Okay. So there's something that needs a little tweaking. But once you tweak it and it gets okay, it should be okay afterwards. Okay. So it's something that needs to be looked at.
It would be great. I mean, when you ask your questions, especially so if you are married, it would be great to know how some of these things are affecting you at home, so that we can have the ultimate reason we're doing this is to be able to ensure that we're happy in our homes with our partners. So if you let us know how these things are affecting your homes, it would be interesting. And then based on that, we are able to tell people who are listening to pick a cue from what you may be going through, so that you don't wait till the point where when we're having time with the urologist, there were a number of questions that came through, and people said, my husband likes it too much and I want to divorce him, and all. I mean, we've been through all of those, so it'll be interesting to know how ultimately some of these things are affecting you at home. This one says, I want to know when you can start tying your tummy after a fibroid surgery.
Why should you tie your tummy after a fibroid surgery?
You want to have a flat tummy.
How big was the fibroid? For most women, the
But Doc, you know that after giving birth, we start tying our tummies,
because
right?
you had in fact 1.5 footballs in your tummy. That's really stretched out your tummy really that big.
Okay.
You understand? So even after you take out the football, you still have the big uterus over there, and it goes down. Your the rectus muscles, the muscles that hold you in, the left and right, the ones that run across like this, they are being stretched. So you're trying to support it to help it come back to shape.
So what if you don't tie it, they don't go back?
If you don't tie it, depending on how much exercise you do, the going back is challenging.
It's a process.
Our mothers or our grandmothers lived very, very active lives. The tying process helped them at the beginning, but because of their active life, those muscles were worked out so hard that it tended to bring the tummy
Back.
back. We live more sedentary lives. So as that result is that even with the tying, if the exercise is not there, it's not really going to come back, not very much. But after a fibroid surgery, unless you had a very huge fibroid, it didn't distort those muscles very much. So the tying is not really going to make that much of a difference. However, we would usually not encourage our people. We usually not encourage any of those things before 6 weeks.
Okay.
After 6 weeks, you may start doing gentle tying. There are abdominal supports that you can put on even the day after surgery. And that is more for pain management than for,
acquiring a flat
tummy. And our problem is once you tell them you can start, then they start doing it very tight, and that causes more pain and more stress for all of us. Usually after 6 weeks, you've healed well enough to be able to do it without too much trouble. Before that, there are special ones you can use for pain management. That will give you some amount of support. But generally, unless you had a fibroid, which is about, that weigh more than maybe 10 kilos or something. Or maybe even 5 kilos.
That's huge.
Let's give you a 5 kilo fibroid. I'm not too sure that is going to do that much for you.
Okay, great. So if you have to do anything at all after 6 weeks, we like to use the waist trainers to, the figure 8. And, some of us are struggling with it, but good morning, Adam. Okay, this one says, what causes bad smell before and after menstruation? This is from Bernice. And our number is 0302216541. We can pick your phone calls. This is Home Affairs. We're live on Joy 99.7 FM, also on Joy Prime, and you can catch us on all our social media handles. You want to send a message to us, you have a question, it is 024-055-1111-997. And if you want to call us right now, it's 0302216541. Doc. About
the bad smell.
Yes.
There are various things that can cause the bad smell. For some people, it's just related to their menstruation.
Okay.
But it's often is related to a particular kind of infection that causes, that smell, and it is exacerbated under certain circumstances. The best thing for her is that whilst at the time that she's having the smell, she see a doctor, get a swab done. They'll send it to the lab and tell us what kind of organisms are inside, and then appropriate treatment would be given.
So ideally, you're not supposed to have any smell.
No.
Okay.
No.
All right. Good morning, Adam and Doc. Please, I started my menses at age 16 and it was 4 days, but the last day was very small. Now it's 3 days, but the third day is very small as well. I am 32 now. Is it a problem? I don't bleed heavily. I don't bleed heavily right from the beginning. So that's a problem.
It may not be a problem. It may not be a problem.
You menstruate for 3 days.
Some
it's
people,
not a problem?
no. Some people, that is how their system is.
I see.
So,
but you hear all these people who sell the things by the roadside, and when you're driving, you hear them say, and now when you do this for 3 days, you have a problem. It will cause this, it will cause that. And that causes a lot of fear and panic.
They are selling their drug. I beg you. We have a culture in this country where you don't spoil somebody's work, even if the person is causing harm.
And you actually hear, I mean, in when you are a growing woman, you have a lot of education from your aunties, your grandmas, and all that, and they also tend to say that to you a lot. Say this thing cannot be for 3 days; it has to be 5 to 7
7
days.
days, yeah.
You do 3 days, there is a problem, and then they begin to give you a lot of concoctions
That
to
you should
drink,
take,
so
yeah.
that
So it may not necessarily be a problem.
I see.
It's if have yourself checked out. If they check it out and there's no problem with you, please continue living your life. This is your version.
All right, though. I remember that would be a very sweet version.
Little bleeding, few days.
I tell you, very sweet version. If there's no problem to it. I remember when my oldest daughter, started menstruation, and we talked about it. He says, so, I mean, the initial conversations, I will have to do it, right? Okay, so I can't wait to get it done and over with. I'm like, like what? After this, you're done.
No.
I'm like, oh no.
Every month, it comes back like
It is-
clockwork.
You live with it. And then she was like, I mean, this is not fair. I said, I'm sorry, but that's what comes with being a woman. She thought that, okay, it's just this once and
That's
it's
it,
done.
yeah.
So we do it and we get it
Yeah.
done and over with. I said, Debbie, doesn't happen that way. After fibroid surgery, I have been feeling heat inside my body. It started from the back around my waist, and I have done all kinds of tests, but still the heat won't subside.
That's odd.
But you know what it is? The heat she's talking about.
No, and and the heat is just down there, not the rest of the body. If the rest of the body, we have an idea as to what that is. If it's just down there, it's a bit odd.
So
And-
no, she says that she has been feeling heat inside her body.
Inside the body.
It started from the back around my waist. So the heat is inside
So,
her body,
yeah, so-
but the beginning point is from her
there,
back
yeah.
around
I
her
think
waist.
it's something that needs to be it needs to be
Checked.
looked at. It needs to be checked. You shouldn't be having heat. First of all, down there, and then let alone all over your body. And something is definitely not right.
After a fibroid
She
surgery.
needs to have it checked out properly.
Okay. So my dear, yeah, let's have it checked, and then we by the grace of God, probably isn't anything, and then you will be fine. Hello, Adam. I'd like to make friends with the doctor. I will read the rest of the message. Hey, this one is okay, but this is from a guy. He says that I would like to make friends with the doctor, not for health reasons, but for the fact that he is so deeply, seriously, fantabulously knowledgeable, and the fact that he speaks broken at the right points. May I have his number, please? Kofi Jesse. Okay.
Kofi Adam has my permission to share my number.
I will share with you. I love all the accolades you're reading on Dr. Aite this morning. Hi, I am Dinah. Is it normal to start menstruation from 7 days and later 5 days and now 4 days? I am 26. I started my menses at age 14. I think we just answered that,
I think
right?
yes, it's possible, and especially the 7 days part is when at the beginning the body doesn't really know what it's supposed. I mean, how to handle it, and as you grow older, it gets a whole lot better.
Okay. This one says that after this we'll take a break. This one says, good morning, Adam. Doctor, please, my daughter's menses have traveled to 10 days this month. Her normal period usually lasts 3 days. Is it a problem? This is from Frederica.
Freddie, yes, it is a problem. Hi. And 10 days is a bit it's
a bit
It's a
stretched.
bit stretched for this particular cycle. It may just be a one-off. That's one of those just one-off. But if it's persistent, definitely it's a problem. And in this case that we've lasted 10 days, if we don't intervene, it may go for a whole month.
Wow.
Yeah.
Okay, so Frederica, quick. See a doctor and let's get to know what the issue is
Freddie, call me.
and help this young woman. All right, we will be right back.
Adriani dede yeko shadia odianwae onga chicken tablets Adriani dede yeko shadia odianwae onga chicken tablets why you me do why you me do why me do onga chicken tablets yummy. Onga chicken tablet. Cook on who give me. Ediani yes weni. Onga dielele. Onga chicken tablet.
Introducing the new Onga Chicken Tablet.
This advertisement has been vetted and approved by the FDA.
Nana, Yen Control. Jumia presents Celebrate Your Everyday. It's Jumia's 9th anniversary and we are celebrating with amazing specials. Enjoy up to 50% discount on your favorite brands. Jumia Day for you, Ankasa. Download the Jumia app. Jumia, your everyday delivered.
All right, thank you very much. It's Home Affairs on Joy 99.7 FM, also on Joy Prime, and we are also live on all our social media handles at Joy 997. I have been speaking with Dr. Paddy Ayete. He is a consultant, OBS and gynae at Elimax, right?
Elima's Health, yes.
Elimax Health, and that's where you can find him. We have been talking generally about women's health, and because we don't want to say that, oh, we are selecting a particular topic, it may not be speaking to you. And so what we are doing is taking your questions and answering them. And so if you have a question for us, we can take your question on 055-1111-997. And right now we are activating our phone lines on 0302216541. So you can give us a call, and Doc will do justice to your question. But while I wait for your calls and most of your messages, Doc, let me share this message with you. You think about it. I go make some money, and then I come back for us to answer it. It says, I normally have vaginal infection after menstruation. I have seen different gynecologists on it several times, done a series of investigations, and they all came out okay. But it is still persistent. What can I do? This is from Ifwa. Ifwa will answer your question in a minute. But while we wait to answer Ifwa's question, Mama's helping hand. How's it said? Ele? That's Onga. Do you know about the new Delicious? Oh yes, Ongalicious is the new Delicious. Create those amazing moments with your favorite Onga seasoning. No matter your cooking experience, Onga is a delight to make great tasting meals in every home. Onga is convenient to use, and it brings out that great taste and aroma in your meals. Let's toast to the new Onga chicken tablet with superior taste and comforting aroma for all your chicken meals. Mama's Helping Hand, proudly Ghanaian. Connect with Onga at Onga Ghana on Facebook and Instagram and Twitter. Onga, Mama's Helping Hand. I love to use it. And have you heard or seen the Power of 8 tours? Well, Adanse Travels, as part of their 8th anniversary, is offering this mouth-watering deal to the capital of Africa, Addis Ababa, and continue the fun in Dubai only for 8,000 Ghana cedis. Doc,
Charlie,
Adanse
we have to
Travels.
talk. Oh, we have to talk.
I know.
I was thinking about it today. Them.
You should be going on the cruise.
It's been a while. That one. I have an embargo.
Okay, don't worry. We'll talk off
I have
air.
an embargo.
But
However,
Doc has been on. Is one of the people who's been on the Adanse Travels trips, and Charlie. We can only tell you that you will get your money's worth. That's all. Just however you imagine it, you will get it. He's thinking about it. But then we can do Dubai.
Charlie.
Just to go and chill small and come.
Embargo. 2022.
Something. That's right. In Addis, you will have fun at Entoto Mountain Park, enjoy traditional Ethiopian coffee ceremony, and spend the night at the magnificent Skylight Hotel. Onward to Dubai. The glamour and live performance from Kwame Eugene at Dubai Desert will mesmerize you. For only 8,000 Ghana cedis, you can be part of this historic Power of 8 to Addis Ababa and Dubai with your flight on Ethiopian Airline, Dubai Visa, 4-5-star hotel, tours and travel insurance all covered. Note that 8th to 15th August, deals are sold. I knew why I paused. Last week we had a fantastic show, and the only message my boss sent to me was, after the show, check the pronunciation of the word August, because apparently I said August and he can't stand that. Elvis, good morning to you. Available spot now is 10 to 17 August and selling very fast. Book your spot at www.adansitravels.com or call 059 55 to book Feel Life's Beauty with Adansit Travels. Doc, our question. The vaginal, the
whitish discharge.
consistent,
Yeah. This question comes up quite a bit. Oftentimes, women notice a whitish secretion, and they always assume it is an infection.
Okay.
For it to be an infection, it must have certain characteristics. If it's yeast, it will be cheesy. In other words, bits and pieces, like you've broken off pieces of cheese. You understand?
Yeah.
And it is itchy.
Okay.
You understand? So if it is not cheesy and it's not itchy, it is unlikely to be yeast.
Okay.
So it is there, it is white, but it may not be yeast. If it's not smelly, it's unlikely to be a different kind of infection.
Okay.
If it's not greenish and flowing,
Greenish?
greenish day, and flowing like something, it is not a different kind of infection. So when you run tests, and you have to run some specific tests, and they cannot find the yeast, which is what most people call whites, and they cannot find all those other infections, it is entirely possible
that fine.
this may be your natural secretion.
I see.
And it does not mean it's an infection.
And if you have a partner and it's making your partner uncomfortable, then what?
Where did he see it? What was he doing that he went to look for it?
Ah.
Sometimes also after sex, you notice that there's some whitish something. Normal.
I see.
It doesn't mean it's an infection. So yes, they have sex, and after sex, they notice that there's a whitish secretion all over the place. It doesn't mean it's an infection. It could be a normal secretion. What we do, we take a swab, we take it to the lab, we run tests on it, we look for infection. If there's no infection inside, there is no infection inside.
You rest your case.
Be at peace.
And so what you don't do, the discomfort it causes you?
Which discomfort? It's not painful, it's not itchy, it's not smelling. It is just that you have a little bit of a white secretion coming out. That is yours.
Okay. So yeah, if perhaps once the doctors have told you that it is nothing, you should relax. And if it is that your partner is uncomfortable, then he probably needs to be spoken to.
He has to have a chat with your doctor. But
Okay,
we have to
great.
be sure that we've checked and they really can't find anything inside. Some people's hormonal balance causes them to have secretions that are in a particular kind of way. It is a normal variation of the normal. It may not necessarily be a problem.
Great. We have a call. Hello. Good morning.
Hello, good morning.
Good morning. How are you?
I'm fine, thank you, Adam.
May I know your name, please?
I'm Linda.
Okay. Hi, Linda.
Hi. Adam, please, I have a friend who has pregnancy issues. She easily gets pregnant and it brings a lot of problems at home. She's very desperate now. As I'm talking, she's pregnant again. Her husband is very upset after 5 kids. Is there anything that doc can recommend for her permanently? Because all the family planning methods are not helping her. She's done everything, and some of them give her high BP, several complications. So we want something permanent for her.
So why didn't she tie her tubes after number 3? And after the third child, she had the 4th accident.
Normal delivery.
No, it doesn't mean you can't tie your tubes.
Okay.
She could have tied her tubes after the 3rd child. She had the 4th, which was the accident. She didn't tie her tubes then. She had the 5th, which was another accident. She didn't tie her tubes
now
then.
She's pregnant with
and she had the 6th.
I have my tubes tied. I recommended that for her, but She's afraid to go under the knife. I don't know what the problem is.
But instead, she doesn't mind having children. You see, life is a matter of decisions. If you know you do not want to have any more children, you take the steps to do that. And she is going to have child number 6. Hopefully, after child number 6, she will have the courage to have her tubes tied. I generally believe that contraception is the responsibility of the man. I don't understand why he is upset when he made love to a woman who wasn't secure. That is problem 1.
Wow.
That is my major problem. The man, if you know you don't want to pay more school fees, I know the school fees I'm paying. If you know you don't want to pay more school fees, when you have had a full stop, ensure that children do not come.
Exactly.
Have a vasectomy. If you can't have a vasectomy, do everything to convince your wife, including bribe, to have her tube tied. Whatever it takes.
Exactly.
You understand? Otherwise, you will be responsible for the fertility calendar. Mark it on the wall and say from 7th to 15th, no sex, bad. It doesn't matter what you do to me. I will not touch you. After 15th, going safe.
We can't.
You will mark it on the calendar and tell your wife. In fact, on these days, I'll sleep in the living room so that there shall be no. Do whatever it takes. It's really surprising for you to be upset at this stage when you were the one who went and had, what time is it? Are the children asleep? You went and had sex. You didn't use condom. You ejaculated inside too on top. And you did, oh Lord. And then now you're upset.
And you know what's painful?
You put your head in the lion's mouth and then you are upset the lion beat you.
What's painful is this woman is pregnant. She's carrying the baby, going through all the stress and the emotions. And your husband is blaming you and angry with you on top.
Woman, no thy husband. Woman, no thy husband. After number 3, who baby?
Oh, 6.
6.
Yeah. Hopefully, so Doc has given all the advice. Yeah. Well, that's a lot.
No. It's upsetting. No.
That's a lot.
No, it's upsetting. She's going through, first of all, the 5 are doing trika all over the house. The last one insisting that you must carry me because they are jealous of the baby that is inside. You are struggling with vomiting and nausea and, the whole... And Sisha, you are an old woman trying to have a child. You're not as young and as strong as before.
This is a tough one.
And
but
then your husband, too, is giving you stress on top. Meanwhile, he is the one who made you pregnant. Did you make yourself pregnant?
Okay, we have now on the line. But the question I have, Daniela and Dennis, please look at it. We've answered this one already, so you might want to let us see another question. But hello now, good morning.
Yeah, good morning. Please, I have a little question for Doug.
Could you help us with Nas volume, please?
Come again?
Yeah, now we can hear you now.
Yeah, I'm almost 64.
Okay.
I had my menopause when I was 45. Since I've not seen blood before, but since yesterday evening, after we I started seeing blood. Please, may I know what it is?
Not good. See a doctor as soon as possible. You are not supposed to bleed after menopause. You are not supposed to bleed after menopause. If you see blood, see a doctor. You need to be checked out properly and thoroughly. I had a cousin who died from this.
Wow.
We shouldn't see blood.
Okay.
See a doctor, let them check you out. If there's nothing, they'll tell you it's
There's
maybe the
nothing.
vaginitis or something. But the major worry is a cancer from higher up. And that is how it starts. So the moment you see blood after menopause, please see your doctor. Have it checked out. You need to be properly investigated, properly assessed, as detailed as possible.
Doc,
Because the condition that we are worried about, if you see it early, it's a simple surgery, end of story.
Okay.
If you see it late, you are dead.
Oh, Doc.
Oh,
How can you be so brutal?
it's the truth. Maybe to make her go to hospital tomorrow Sunday and they'll sort her out.
Okay. Menopause, right? When are you fully declared menopausal?
Hey, trouble. Okay.
What have I asked?
You have to try and avoid technical. So basically, initially you'll be having your menses in your menstrual cycle changes.
Okay.
It may actually become shorter and shorter. Then after a while, the menses tends to stop
Okay.
for a couple of months. Then you have one bleed, and then it stops for a few more months. You have another bleed, and then after eventually it stops totally.
Okay.
During that time, initially you'll be feeling okay, but after a while you start having the hot flashes,
All the things.
which comes from the withdrawal of the hormones
Okay.
that control your menstruation. And then after a while your body adjusts
To
to those hot flashes and they no longer become an issue. And that's part of the reason why we don't have hormone replacement therapy a lot in our part of the world, because we tend to know that give it a little bit of time, you get over
Okay.
it. And if you try and replace it, sometimes it causes more trouble than it is actually.
What I'm actually
Well.
asking is the start stop that you're talking about. At what point,
When it stops.
when it stops,
Yes.
and you're not expecting it to start again?
Yeah,
How long should they have
it's
stopped?
It's not a matter of you expecting it not to start again.
Okay.
If you come to us and you tell us you haven't had your period for about a year, we cannot believe that you are menopausal.
Okay.
If you haven't had your period for about 3 months, it may not be clear.
Is that
yet
dependent on
that-
your age?
Well, there's a research in this country that shows that the average age for menopause was 48 years.
Okay.
I know people who are in their 50s who are still having their menses. I know people who are in their mid 40s who have become menopausal, but the average is about 48 years. I think the way it happens more depends a bit more on genetics rather than age per se.
Okay. Hi, Frederica. Good morning.
Good morning.
Yes, please.
Please, I want to ask Doc, I'm 22, and my menses started since February, and it was coming. In March, I went to the hospital, and I went for a scan, and the results came as bilateral polycystic ovaries. And I was given injection. Within 5 days, it stopped. But I started in May again, and it's not stopping.
Yep, that's the nature of the disease condition. What the injection did was to try and stop the bleeding for a little bit, but the injection's effect is going to wear off, and once it wears off, the bleeding comes again. The main problem with it is a hormonal problem. It's a hormonal imbalance. It needs to be. There are medications that you can give, readily available. Once we correct the imbalance, this is my area of special interest. Once we correct the imbalance, usually after 3 months, your menses will come back to a normal cycle.
Okay.
And then the challenge, warning, people with polycystic ovaries tend to have ovulation problems. The moment we correct it, you will be ovulating. It means you can get pregnant.
I see.
So it can be fixed. And we need to give you medication to stop to control the periods, but stopping the periods doesn't solve the problem. The actual problem needs to be addressed, and once that happens, your system will come back to normal.
Okay.
Please, can I get Doc's number?
Please.
Okay. Yeah. We will let you have it. Okay.
Okay, thank
All
you very
right,
much.
thank you. And have you tried the new NutriDay yogurt? It is Ghana's newest delicious and nutritious yogurt from Fan Milk. NutriDay contains zinc to support your immune system. It also contains vitamin A and B12 for good eyes and mind. Try NutriDay today. NutriDay, strong every day. And everyone can use Koba. It's got a payments channel for the big bosses, the market woman, the mechanic, the cocoa seller, and the small shop owner. So sit back, relax, and simply pay for your Old Students Association dues. Doc, you should tell your primary school group. And contributions. Transfer funds from across all bank accounts or mobile money wallets. Top up airtime and data. Pay your insurance, your TV subscription, utility bills, pay school fees, and pay for that wache. That's the part I like, the wache. So the wache people who don't want us to do transactions using Koba, please repent. Do all these and more on Koba and get a free life insurance cover with Prudential Life whilst you transact your businesses on Koba. Use Koba and enjoy life's little pleasures. Download Koba on Play or App Store or via the WhatsApp channel 0242 426186, number 0242 2426186, or just dial star 365 hash and follow the prompts. Korba, our lives simplified. Hello, good morning.
Good morning, Madam.
Hi,
and good
how are
morning
you?
to the fabulous doctor in the studio.
It doesn't look like you have any problem. The way you are sounding will say to you.
Adam, the doctor is so great. The lady that is having the problem, me, I'm a practical example. My husband was doing the same thing. My third child, my fourth child. Let me tell you, asking me to go and get rid of it. With all the stress, when I was to go through premature CS to remove the baby because I had BP complications, look, he came there, not even helping in the situation, worsening it, and left. And after they removed the baby, I was bleeding to death. They asked for another surgery. The doctor said they had to do this tuber blockade that the doctor is recommending for this, my friend. My husband never stepped there. I signed the papers myself.
Wow.
Afterwards, when this one is now getting to 2 years, when he comes, he's coming to have sex. After sex, he will ask you, what can you be able to protect your one?
Oh.
And yes, I am Please, as for the men, when they are in the mood, let me talk to my sister directly. They don't tell my sister to have that boldness and then let them do the tuber blockade. That has helped me. Now I don't care. And he has never even had the guts to ask that, oh, what have you done? And you've never complained of pregnancy anymore. And he's not asked what sort of CS, the second CS they did, what was it? So men, all that they are after, I'm telling you, is their satisfaction when it comes to sex. Once that 6-10 minutes is over, they are okay. The complications that will come after, they don't have any remorse for you, the woman. So my sister there, do the tuber blockade, that will help you. Like the doctor said, me, none of those things, because I used to bleed 6 times in 1 month. So none of the very this thing that help. So if you would do the tuber blockade, and that is the only way that will help you and bring sanity in your house, please go through it. And it's very safe. Me, I've done it, and I'm very safe, and I don't have any complications. It's even corrected my menstrual order, and I'm happy.
Great.
So do it after this child, and you'll be okay. Thank you, and good morning, City.
Thank you very much. But I mean, would like to say that not all men are that insensitive, you know. We do understand that, yeah, 1 or 2, but right now the crop of men we are finding around, they are very, very, very concerned. So we'd like to give props to, you know, those men who are there, like they're there, you know, props to them. And if you're one of the people who was just called out, I beg you, repent. Okay, I am 33. I found out I have a single ovarian cyst. It hurts during my ovulation. Also, my body gets very hot during ovulation. It's been there for some years now. Is it normal? Also, the cyst, will my cyst affect my fertility? Because I'm yet to give birth. I haven't started trying for babies yet.
Well, it depends on the size of the cyst. It depends on whether it's hormone secreting or not. But yes, the cyst can cause problems if it's big or if it is hormone secreting.
Okay.
So, and the fact that it has been there for a while, I think is a bit of an issue. Ovarian cysts usually would come and go. So if it has come and is not going and it's been there for quite a while, I think it's something that needs to be looked at and needs to be addressed. I would suggest she sees her doctor.
Okay. One more time. Do you know about the new Delicious? I am talking to you about Ungalicious. And that's the new Delicious. Create those amazing moments with your favorite Onga seasoning. No matter your cooking experience, we're telling you that Onga is a delight to make that great tasting meal in every home. Onga is convenient to use and brings out the great taste and aroma in all your meals. Let's toast to the new Onga chicken tablet with superior taste and comforting aroma for all your chicken meals. Onga is Mama's helping hand. Onga proudly Ghanaian. Connect with the team at Onga at Onga Ghana on Facebook, Instagram, and Twitter. We'll try and take one more question before we wrap up. Hello, Edem. And Doc, I am Kafui. Went through some stress. I went through some stress a month ago and had some relationship issues too. It's making me think a lot, and I've been growing lean, and my breast too is shrinking and feeling weak. Please, is this normal?
No, it is not normal. 2, if you are growing lean, you grow lean everywhere. So that means your tummy grows lean, your bum grows lean, your breast too grows lean. 3, there's something that we can do for you that will handle that stress situation.
Okay.
I've recently found something that actually deals with that situation quite well.
Okay.
And I've got, some clients who tell you that over the last 1 month or something, they can sleep now, they can handle the stress, they've been able to accommodate the challenges that they've had in their life. I've actually had people who are suicidal who
are fine now.
And they've reduced their meds and things of that sort. So every day God reveals things, and we realize that we didn't know this, and then it actually gets better. So I think we should be able to get something, in her case in particular, we should be able to get her something that would address
the stress. Okay.
We can't solve your problem. The problem, dear Charlie, you have to find a way to manage it. We can only counsel you and help you manage the stress. And hopefully she will gain the weight in her
breast
back. She didn't complain about the other parts of the body.
No, that
only
seems to be a very big worry.
Yes.
So Doc is saying that it is the weight you're losing that is also making your breast shrink. And the weight loss is as a result of you being unhappy and you being stressful and all that. So if your stress is taken care of, then most likely you're back to your normal self. But the problems with you and your partner is a different thing to deal with. Otherwise, Doc, what? Once the problem is there and it is bothering you, you could be taking the medications, but you'll be going in and out, right?
Well, she will definitely be better. She can cope.
Okay.
She can cope better with the problems. That's we found that is true. However, she needs to address the problem. And sometimes I tell people that people come into your life for various reasons, and it's like a play. They come onto the stage, they perform. Some people will stay on the stage forever. Some people will leave the stage.
Yeah.
It's okay. It's life. It gets better.
All right, good. And this is the very last question. I am 39. I had IUD, took it out in December, and now I am worried I cannot get pregnant.
So at 39, she took out an IUD because she wants to get pregnant. I'm assuming so.
I assume so too.
And she hasn't succeeded in getting pregnant over the last 7 months. Well, there are so many questions that we have to ask. Are you having sex frequently? Is the sperm still good? Are your periods regular? Are your hormones balanced? There are so many things that can affect your ability to get pregnant. So that may be totally unrelated to the IUD that you were having. I mean, I'm sure there were times in life that she was having sex for 6 months and didn't get pregnant, even though she was not on an IUD. So it's something that if you really want to have a child and you are at that age, I think it's important. Basically, fertility reduces after the age of 35 significantly. So once you hit 35, your chances of getting pregnant are less. Once you hit 40, they are less. So if you are at that stage, at that age, we don't actually tell you wait 1 year. We are like, no, if you're not getting pregnant within 3 to 6 months, we need to start doing something about it, but your chances are lower.
Great.
So I would suggest that she doesn't just wait, but she should see a fertility specialist to try and work on her, find out what the problem is, and try and address it as quickly as possible. Because with every day, the egg quality reduces, and your eggs are as old as you are. It's one thing women need to remember. You were born with your eggs. So if your kotoje is paining you, the egg kotoje too is paining. It's the same thing. It's not like men that we produce new sperm. Your egg, you were born with it. It's as old as you. So you know the way you were 18 and you could work the whole day and party the whole night and still go to work the next day.
They behave the same way.
No. Now you are 40. Now when it's 6 p.m. you are sleepy. That is how your ex-2 are behaving.
I see.
You understand? Risk of Down syndrome, all those things are higher with age. So she should expect that fertility is not the same as before, and her time, she doesn't have as much time as she would have had when she was younger. So she needs to have it looked at as quickly as possible.
Great. And happy birthday to Her Excellency Professor Margaret Ivy Amakohenge, a member of the Council of State. Today is your birthday, and this is from my own Seth Kwame Boateng to you. Happy birthday to you. So next week, Doc will be here again. Doc, do you have a number you want to put out? Because the people who want, you would want to.
I would give you the office line so that we can. Except the guy from Tema, he can have my number.
Okay, all right. His name is oh God, I remember.
Something JC, I think.
Yes. All right, and again, I'd like to say belated happy birthday to Adira and Adara Night, my twins. They turned 13 yesterday, and a classmate of theirs, Derek Kojo Otin, he also turned 13 yesterday. So happy birthday to you people. They are coming up very strongly with a lot of their own issues, but yeah, just God bless all of you.
Can I just say?
Yes, please.
2 things. A client of mine at the age of 29, the husband came and saw me and said, "This is our second child. We don't want to have any more children." Usually at that age, we are like, let's wait. And they were like, no. He says, I know what my wife goes through when she's pregnant. We have 2 children now. We will not have any more. I said, age? They said, no problem. We are sure as to what we want. The man was the one who led the discussion. Wrote the letters and everything. We did it for her. I mean, it's upon their request.
But why didn't he do vasectomy?
And
ask the woman to go and do it?
We're doing a surgery for her, so it was more convenient for us to do her own.
He should have just done the
just
other
to say
one.
that there are some husbands too who are very, very concerned as to the fact that they can.
But he should have done a vasectomy.
The other thing is a friend of mine. I told her she's pregnant,
have to go.
And she says she used emergency contraceptive. And we will have that discussion if you like next week.
Okay, we will actually begin with that. Okay, so thank you all very much for doing the listening. You can send a message to the WhatsApp line 05511119997 if you need Doc's number, and then we will let you have it. But next week we will be here. Weekend City Show is up next. You have News File coming up. We have Sports Link. You have Showbiz A to Z. You have Uncle Paul coming up with Flashback, and then you have DJ Black. So our day is so packed. You want to stay with us and enjoy all our programs. My name is Adam Nightstay. Thank you, Doc. Next week we will come your way with another time with the Gynae. Bye-bye.
Oje ko iswolo.
Inzina ololoto.
Binyamacho. Oh, Marino, boss.
Now your morning just got better with the Vodafone Good Morning offer. The Good Morning bundle gives you unlimited calls to Vodafone numbers, 5-minute talk time to other networks, and 500 megabyte data. This bundle works with any other bundle you have or will subscribe to. Just call short code 543 or dial *543# to subscribe to the Vodafone Good Morning offer for only 1 Ghana city. Terms and conditions apply.
Vodafone. Together we can.
The boys are back, oh!